Understanding Strokes, a comprehensive guide. In the realm of medical conditions, few are as urgent and potentially devastating as strokes. These sudden disruptions in blood flow to the brain can lead to dire consequences if not promptly addressed. In this comprehensive guide, we delve deep into the world of strokes, shedding light on their origin, classification, dangerous consequences, and providing real-life examples of individuals affected by this condition. Our aim is not only to educate but also to empower you with the knowledge necessary to recognize the signs, seek help, and potentially prevent strokes. Learn more about preventing strokes in our dedicated course. Origin of strokes. Strokes, also known as cerebrovascular accidents, are medical emergencies that occur when the blood supply to the brain is interrupted or reduced. This disruption can have several origins, including ischemic strokes. These are the most common type of strokes, accounting for about 85% of all cases. They occur when a blood clot or plaque buildup narrows or blocks an artery supplying the brain. This blockage deprives brain cells of oxygen and nutrients. Hemorrhagic strokes. These result from the rupture of a blood vessel in the brain, causing bleeding into or around the brain tissue. Hemorrhagic strokes are less common but often more severe. Transient ischemic attacks, TIAs. Sometimes referred to as mini-strokes, TIAs are temporary disruptions of blood flow to the brain, typically lasting only a few minutes. While they don't cause lasting damage, they are warning signs that a more significant stroke may be imminent. Classification of strokes. Strokes can be classified further based on their specific characteristics and causes. Embolic stroke. This type of ischemic stroke occurs when a blood clot or other debris forms in another part of the body, typically the heart, and then travels to the brain, blocking a blood vessel. Thrombotic stroke. These strokes occur when a blood clot forms within one of the arteries supplying blood to the brain. Such clots often develop in areas where there is atherosclerosis, a condition involving the buildup of fatty deposits. Intracerebral hemorrhage. This type of hemorrhagic stroke takes place when a blood vessel within the brain ruptures, leading to bleeding and pressure on surrounding brain tissue. Subarachnoid hemorrhage. A subarachnoid hemorrhage results from bleeding into the space between the brain and the thin tissue that covers it. It is often caused by a ruptured aneurysm. Understanding the dangerous consequences. The consequences of a stroke can be severe and life-altering. Here are some of the dangerous consequences associated with strokes. Physical impairments. Strokes can cause partial or complete paralysis on one side of the body. This can lead to difficulties with mobility, balance, and daily tasks such as dressing and eating. Cognitive challenges. Many stroke survivors experience cognitive impairments, including memory problems, difficulty with concentration, and language deficits. Communication issues. Aphasia, a condition affecting speech and language abilities, can result from damage to the brain's language centers. Emotional impact. Strokes can trigger emotional changes, including depression, anxiety, and mood swings. Coping with these emotional challenges is an integral part of stroke recovery. Risk of recurrence. Individuals who have had one stroke are at an increased risk of having another. Prevention measures become crucial to reduce this risk. Early warning signs and risk assessment. Recognizing the early warning signs of a stroke is vital for prompt intervention. Common signs include sudden weakness or numbness in the face, arm, or leg, often on one side of the body. Confusion, trouble speaking, or difficulty understanding speech. Vision problems in one or both eyes. Dizziness, loss of balance, or lack of coordination. Severe headache with no known cause. Real-life examples. To truly grasp the gravity of strokes, let's explore more real-life examples of individuals who have faced the challenges posed by this condition. John's journey to recovery. John, a 55-year-old accountant, experienced a severe ischemic stroke that left him with right-sided weakness and difficulty speaking. He embarked on a challenging but inspiring journey of recovery, undergoing intensive physical therapy and speech therapy. Through sheer determination and the support of his healthcare team, John has made remarkable progress in regaining his mobility and communication skills. His story serves as a testament to the resilience of the human spirit and the crucial role that rehabilitation plays in stroke recovery. Case studies. Case study: rapid intervention saves a life. This case study underscores the critical importance of recognizing stroke symptoms and seeking immediate medical attention. It narrates an instance where prompt intervention by bystanders and emergency medical personnel saved a stroke patient's life, highlighting the life-saving potential of rapid stroke response. Case study: Advances in stroke rehabilitation. This case study explores the application of cutting-edge rehabilitation techniques, including robotic-assisted therapy, in helping stroke survivors regain mobility and independence. It highlights the role of technological advancements in enhancing stroke recovery. Case study, addressing post-stroke depression. Post-stroke depression is a common consequence of strokes. This case study delves into a comprehensive approach to managing post-stroke depression, combining therapy and medication to provide effective treatment and emotional support to stroke survivors. Success stories. Success story, from stroke survivor to marathon runner. This inspiring story narrates the journey of a stroke survivor who not only regained mobility but also defied the odds by becoming a marathon runner. It showcases the remarkable physical and mental resilience of stroke survivors. Success story, overcoming aphasia. This success story follows a stroke survivor's remarkable journey to regain language skills and return to her profession as a speech therapist. It underscores the importance of perseverance and the human capacity for recovery. Success story, stroke recovery through music therapy. Discover how a stroke survivor found solace and healing through music therapy, unlocking new avenues for communication and emotional expression. This story highlights the therapeutic potential of music in stroke recovery. Ready to take proactive steps in preventing strokes? Explore our dedicated course on stroke prevention here. Frequently asked questions, FAQ. What are the primary risk factors for strokes? Strokes can be triggered by various factors, including high blood pressure, smoking, diabetes, obesity, and family history. Reducing these risk factors can play a crucial role in stroke prevention. How can strokes be prevented, and what steps can I take? Preventing strokes involves lifestyle changes such as maintaining a healthy diet, regular exercise, controlling blood pressure, and avoiding smoking and excessive alcohol consumption. Regular medical checkups can also help identify and manage risk factors. What immediate action should I take if I suspect someone is having a stroke? Time is critical when dealing with strokes. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call 911. Act promptly by seeking medical attention. What role does rehabilitation play in stroke recovery? Rehabilitation, including physical therapy, speech therapy, and occupational therapy, is essential for stroke survivors to regain function and independence. It can significantly improve the quality of life after a stroke. What are the early warning signs of an impending stroke? Early warning signs of a stroke include sudden weakness or numbness on one side of the body, confusion, trouble speaking or understanding speech, vision problems, dizziness, and severe unexplained headaches. How are strokes diagnosed, and what tests are involved? Strokes are typically diagnosed through imaging tests such as CT scans or MRIs. These tests help identify the type and location of the stroke, enabling doctors to determine the best course of treatment. What treatment options are available for stroke patients? Treatment options depend on the type and severity of the stroke but may include medication, surgery, or interventions to remove blood clots. Early intervention is crucial to minimize damage. What are the potential long-term effects of a stroke, and can they be mitigated? Long-term effects of a stroke may include physical disabilities, cognitive impairments, and emotional challenges. Rehabilitation and support services can help mitigate these effects and improve the overall quality of life. Is it possible to lead a fulfilling life after a stroke? Yes, many stroke survivors go on to lead fulfilling lives. With the right support, rehabilitation, and adaptation, individuals can regain their independence and pursue their passions and goals. Where can stroke survivors and their families find support and additional resources? Support groups, healthcare professionals, and organizations dedicated to stroke recovery and prevention can offer valuable resources and a sense of community for stroke survivors and their families. Conclusion. By being informed, proactive, and inspired by the stories of resilience, we can reduce the impact of strokes and improve the lives of those affected by them. Staying vigilant and promoting stroke awareness is key to preventing and managing this critical medical condition. Continue your journey to stroke prevention with our comprehensive course. If you have further questions or need more information, please don't hesitate to reach out to us. Together, we can work towards a future where strokes are better understood, prevented, and managed for the well-being of all. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.